touches people deep down and allows, this is why we're going to be successful here. People just don't know about this, and as they learn about it, and Mike DeWine's comments about, you know, when you're getting your nails done, or when you're getting your hair done, these cosmetology shops or places where this can happen, you know, his comments about practical ways, and Mike, maybe on that website you ought to list about, you know, the kind of the 10 signs to look for, because, you know, we all have occasion, and we all have to stand up.
Are there any funding concerns when it comes to the safe harbor services, and is that addressed in the bill?
Specifically, it isn't, because what we haven't done is figured out how to service the victims, because we don't see them as human trafficking victims. So we have to start somewhere. Many of them already qualify for services. Many of the most vulnerable victims in the most vulnerable population in Ohio come from children's services. We're 9th in the nation of child abuse. We can clean that up. We're 50th in the nation of funding children's services at the state level. I'm going to influence that.
Well, we're all for you.
Good.
What have you been doing since I got here?
We're talking.
We got more done in the last 12 months on these issues than we did in the last 20 years.
We're talking, and what I'd like to do is to tie the threads of these facts that are not good for the health and well-being of our children in Ohio in general. I keep coming into these issues because my background is early childhood. I kind of look at the health and well-being of our children, and I try to see, well, why is that? Well, I think the child abuse rate in Ohio is directly tied into vulnerability and how vulnerable our children are, because these traffickers know where to go. Many of these children are so traumatized before the traffickers get them, and they're going through a juvenile justice system, maybe because of truancy and other issues. They're runaways because of child abuse. They're not getting the long-term trauma treatment that they need just in those life issues, and then they are vulnerable and maybe entrapped into trafficking, which makes it even more horrific, which means we need to have more therapeutic foster homes. We can do what we can do with what we have, I believe, right now, and see where we are, and pull down more monies. We're already looking at the grant monies at the federal level and seeing how we can coordinate that. So this executive order is very important in linking what we already have and what we can do, and that we don't need legislation for.
Let me talk about a couple things. First of all, you know, when we did Medicaid, I talked to the president about our Medicaid reform, and in fact our Medicaid people are talking to the administration. We decided when we did Medicaid to protect children on that. You know, when I was a congressman, I was one of the co-sponsors of the program to provide health insurance to low-income families because of children. And Greg Moody, who's here with us today, you know, we didn't cut off services for dental and things like that for children. I think we've left too many federal dollars on the table, and we're working to figure out why that's the case. But, you know, as I say, Ohio's had so many broken plates in the cupboard. It's just one after a time. That's why we got a 3,500-page bill here to try to improve the government operations. The other thing, though, that you need to know is, and I got a lot of flack from some of you about why I went after the casinos after they made their deal with the taxpayers. We got $240 million out of those people. You know, there's a reason for that, because that gives us a little bit of breathing room on things that are high priorities for us. And I'm glad, you know, we're getting the money for the tracks and all that. All these extra dollars we get, and then as we get stronger and as our revenues grow faster, it allows us to do more things. So we've got to rebuild the mental health safety net in this state. We've got to do more to help children. You know, thrilled we got the $70 million grant for early childhood education. You know, we just have to keep working and thinking and being creative. We'll never fix it all, but we can improve it, and that's what we're trying to do.